We're continuing our conversation with Dr. Kenneth Hilty with Cone Health HeartCare about managing your cholesterol. So this is something that we're hearing a lot about these days, LPA or little a. What is this and why is it getting so much attention?
Yeah, the lipoprotein little a we've known about actually since the 1960s, but not really had any good treatments until recently. And now we have a renewed interest in testing for it. It's a separate blood test. It's a genetically determined LDL-like cholesterol with a little protein on it that is a little more likely to cause heart disease than LDL alone, which is the bad cholesterol. So the real key is if you have a strong family history of heart disease in your family, it would be important to ask your doctor to do specific testing for that. And it's just a regular blood test that you can do. But there are some treatments to lower it and emerging treatments that are available, including clinical research trials that we're involved in at Cone Health that can help lower your risk if it's elevated.
All right, so you talked a little bit about treatments and things. How common is LPA?
It's very common, actually. It's about 20% of the population may have an elevated level, and the increase of that level, again, it's not affected by diet or lifestyle, weight loss. Even certain medications don't lower that. So it's important to look at it, testing that in addition to regular cholesterol testing, because again, other therapies are really kind of on the horizon for treating that, and I think it's been an under recognized risk factor for heart disease.
Okay. What are the maybe like misconceptions about cholesterol that you think to yourself, you know what, I've got a captive audience here, let me set them straight?
I think that there's a big misconception between, again, the connection between cholesterol and the development of heart disease, right? Because we all do know some people that don't seem to have a whole lot of heart disease, even though their cholesterol numbers are very high. But we do know that it's a significant risk factor. We have many years of data suggesting that lowering cholesterol by any means, whether it's a statin medication or other medicines or diet or lifestyle, lowers your cardiovascular risk, and that's really important. Until you do that testing, like we talked about earlier, until you know that you may be at risk, we have to identify that risk first before we can help you lower that.
Okay. And who should someone contact if they're concerned about their cholesterol? Do we first go to our primary care provider, get blood work, that kind of thing?
Yes, absolutely. There are not a lot of people that do what I do, so generally I'm seeing the more challenging cases, and we do want you to start with your primary care provider. We want you to reach out just to do a regular cholesterol test, and they're very well equipped to do that. We have excellent primary care providers in our community, and they can pretty well treat you, right? But we're here to help out in cases where it may be difficult, or you have intolerances to medicines, or perhaps there's a much higher genetic risk. We also offer genetic testing, and the health system offers free genetic testing through the Helix program, it's called. So there are a lot of options as ways to kind of try to further test, for what your risk is, even at very little to no cost.
And for folks who maybe don't remember or don't know, a cholesterol test is a blood test. And talk a little bit about what goes into that, what you need to do before that test.
That's right. It's a pretty simple blood test. It's generally we like to have you fasting for the test. That's about 6 to 8 hours or so. So I usually tell patients don't eat after midnight. Go in early for your labs in the morning, and that just gives us really kind of our most accurate number. And again, it does vary a lot based on what you eat, and so getting I think the fasting test is a cleaner test. But if you're able to get any test, even if it's non-fasting, that would be helpful. It's better than not knowing your cholesterol at all.
All right, we got about 30 seconds or so. One final thought on cholesterol for folks who are listening.
Yeah, I just think it's important for people to get tested. I think it's something that, like you mentioned before, you don't really have any outward symptoms of that, and I think a lot of people feel like they're healthy, and they may very well be, but you could have a genetic cholesterol disorder, and you may have very increased or high risk that you're not aware of. Unless you do that testing, you'll really never be able to, kind of identify that risk. But the earlier you start treatment and we identify risk, the better your long-term outcome is.
All
So.
right, well, thank you for your time and your expertise. And if you want to watch this again, this is going to be in the To Your Well-Being part of our website.